Last time we have seen about the right atrium part we have started. We have seen the gross features of the right atrium as well as we have started the internal structure of the right atrium. In the internal structure of the right atrium, we have seen that there are three walls of the right atrium. We have seen there is the anterior rough part, posterior smooth part, which is also called as the sinus venerum part. Anterior rough part was picked up from the right half of the common atrial chamber. Posterior smooth part we have seen it has developed from the sinus venous part which is absorbed into the right atrium. Now we can call it sinus venerum part. Under we have seen the left margin is called as the septal wall of the right atrium. The left wall is called as the septal wall of the right atrium. In that case, we have completed the two walls in the last lecture. First wall we have completed is the anterior rough part of the right atrium. That we have seen there are two features in the anterior rough part of the right atrium. One we have seen that grace-like line which is called as the crista terminalis. That crista terminalis is separating the anterior rough part from the posterior smooth part. That part we have seen, it is seen from inside also. Okay. From outside we have said it is the sulcus terminalis. Inside we have seen it the crista terminalis. And we have seen the muscular arrangement from the crista terminalis, which is resembling with the teeth of a comb, so it is called the muscular pectinative. And the function of the muscular pectinative, they are slowing the speed of the blood. Okay, that is turbulence of the blood. It is slowed down because of the muscular pectinative part. Okay, that are the features we have seen last time in the anterior rough part. So that we have seen one diagram for this internal structure of the right atrium. We have seen that this is the opening of the superior vena cava. We have seen that this is the crista terminalis from the inner side. We have seen this is the reflective portion of the anterior rough part of the right atrium, and we have seen that the muscles which are extending from the crista terminalis, they are arranged like this, and so that they are called as the muscular pectinative. Last time we have completed this portion, that is the anterior rough part of the right atrium. Anterior rough part of the right atrium we have seen or completed last time. Then on the inferior aspect, we have seen there is one opening of the large vein that is called as the inferior vena cava. Just by the side of the inferior vena cava opening, we have seen the opening of the coronary sinus. Then we have seen this rough margin of the right auricle on this side, which is actually extending up to one opening here, and this opening is nothing but the opening of the atrium to ventricle, that is called as a right AV auricle. Okay, right AV auricle, that is atrioventricular orifice, or it is called as the tricuspid orifice. So, because it is guarded by this tricuspid wall, it is having one septal leaflet one anterior leaflet and one posterior leaflet. There are three leaflets for this wall, which are guarding this orifice. That is, one is the septal leaflet, one is the anterior leaflet, and one is the posterior leaflet. Okay. Now, in the posterior smooth part, what we have seen, it is formed by the absorption of the sinus spinarum part, that is the called sinus spinarum part, which is called sinus spinarum. We have seen in that case the opening of the superior vena cava, which is having no wall because it is the blood is flowing towards the direction of the gravity. We have seen the opening of the inferior vena cava in the posterior smooth part, which is guarded by the wall, which is called as the eustachian wall, and which was the derivative of what? It is the right venous wall. Okay, the right venous wall. We have seen the embryological aspect of the right atrium also last time. We have said that the distal luminalis along with the wall of the inferior vena cava, along with the wall of the coronary sinus, all these three are the derivatives of the right venous wall. It is the derivatives of the right venous wall. At the same time, we have seen there is one tubercle of the elevation here in the posterior smooth part, and which is called as the intervenous tubercle of lower. It is called as the intervenous tubercle of lower. The function of the intervenous tubercle of lower is that the blood which is passing through the superior vena cava, it is flowing on the intervenous tubercle of the lower, and immediately because of the elevation, the direction of the blood it is changed. Blood flow it is changed because of the elevation. Okay. So that it is actually helping to change the direction of the flow of the blood from the superior vena cava. It is directed to the left atrium directly. It is directed to the left atrium. That is the function of the intervenous tubercle of the lower, which is actually getting degenerated, or very small elevated part will still remain in the adult part, but it is actually not much elevated portion seen in the adult part. Okay, but it is present. Now, next part we have seen, which is present between the coronary sinus and the opening of the inferior vena cava in the sinus septum, which was the remnant of the inferior limbic band. We have seen that the intervenous tubercle of lower is the remnant of the superior limbic band, which was the transverse extension from the right venous wall, which was the transverse extension from the right venous wall. The lower transverse extension from the right venous wall is in the form of the remnant as a sinus septum here, which is present in between the inferior vena cava and the coronary sinus. Inferior vena cava and the coronary sinus. Now, one wall which is remaining now, they are able to see. It is called as the septal wall. It is called as the septal wall, or it is also called as the right wall of the interatrial septum. Right wall of the interatrial septum. Why it is called as the right wall of the interatrial septum? If suppose this is the interatrial septum, suppose this is the interatrial septum has a right wall and it has got a left wall. Left wall is facing towards the left atrium, while the right wall is facing towards the right atrium. Okay, because it is separating the two atria. So this is the right wall and this is the left wall of the interatrial septum. So that the septal wall is also called as the right wall of the interatrial septum. Right wall of the interatrial septum. Now, what are the features which are seen in the right wall of the interatrial septum or the septal wall? The first feature which we are going to see in the septal wall, it is called as the fossa ovalis. It is called as the fossa ovalis. Now, what is this fossa ovalis part? What is this? Fossa ovalis part, it is a remnant of the foramen ovale. It is a remnant of the foramen ovale. Now, what is foramen ovale? Now we again go slightly towards the embryological part. We can say that it is a common atrial chamber. It's called a common ventricular chamber. We have seen the lower part. Now here it is a two-chambered heart opening. It is a two-chambered heart opening. Now what happens if you take the cross section here at the atrioventricular junction? You can see it is an oval opening, which is opening present between the atrium and the ventricle. Now what happens? You can see that from this oval opening, from the posterior aspect, the endocardium starts going towards the anterior aspect. The endocardium starts going towards the anterior aspect. While from the anterior wall, the endocardium starts going towards the posterior aspect. And when the both takes place, one day by day, what happens? The two extensions they come together and they meet with each other. They are meeting with each other. And now what is this called as? Because of this septum, the opening is divided into two halves. The opening is divided into two halves. One is the right half, one is the left half. One is the right half and one is the left half. And now this cushion-like structure, which is actually present here, it is situated here as a junction. That is the called as the septum intermedium. This septum is now called as the septum intermedium, which is situated between the atrial chamber and the ventricular chamber. Atrial chamber and the ventricular chamber, or sometimes it is called as the atrioventricular endocardial cushion. This septum, that septum intermedium, it is also called as the atrioventricular endocardial cushion. Okay, atrioventricular endocardial cushion, which is separating the atrial chambers from the ventricular chambers, which is separating the atrial chambers from the ventricular chamber. Are you getting this? Now, what happens when this develops, the septum intermedium or the atrioventricular endocardial cushion, if whenever it is developing from the roof of the common atrial chamber, from the roof of the common atrial chamber, one septum starts developing. One septum starts developing from the roof of the common atrial chamber. Okay. Now, from where to where it is growing? It is going towards the left half of the atrioventricular endocardial cushion. It is not straight, mind well. It is not straight. Okay. It is not ending on the intermediate portion of the atrioventricular endocardial cushion. Where it is ending? It is ending or it is actually going towards the left end or left edge of the atrioventricular endocardial cushion. And now if you see where it is growing, the gap is still remaining from where the blood is actually coming from the superior vena cava. The blood is pouring from the inferior vena cava into this right half. From the, we have seen that somewhere here is the right venous wall, this is the left venous wall of the atrium, that is the opening of the sinus venosus, which is present over the right half of the common atrial chamber. Now, this is the opening of the sinus venosus, and the venous blood is poured into the right atrium now. This venous blood, which is poured through the opening of the sinus venosus, it is directed to the left atrium through the gap between the septum and the AV cushion. Okay. Now, this opening, which is present from the inferior aspect of the septum, it is called as the ostium primum. It is called as the ostium. Ostium means what? Opening. Okay. So this is called as the ostium primum. And the septum, where it is actually what we can say, extending from the roof of the common atrial chamber towards the atrioventricular endocardial cushion. This septum, it is now called as the septum primum. It is called as the septum primum, which is extending from the roof of the atrial chamber, going towards the left edge of the atrioventricular endocardial cushion. That septum is called as the septum primum. And the gap between the septum primum and the atrioventricular endocardial cushion is now called as the ostium primum. Okay, or foramen primum also sometimes. Okay, ostium is the opening, foramen is also the opening, so it is called as the ostium primum. Now what happens now? Just see how many chambered heart is present now. 1, 2, 3 and half. Like that. Now what happens now? After the formation of the ostium primum, one fine day, the septum primum touches the left edge of the atrioventricular endocardial cushion. But now see, there is a difficulty for the passage of the blood. So whenever the septum is touching the atrioventricular endocardial cushion, then we can see the second foramen starts growing from the cranial end. The second foramen starts growing. That is the area or part of the septum primum. It gets degenerated. One foramen starts here, and the blood will be passed from here to here. Now this is the second foramen, so it is called as ostium secundum. It is called as a ostium secundum. At the same time, when the ostium secundum is formed, this is called as the ostium secundum part. Okay. When the ostium secundum is formed, one more septum starts going from the left margin of the septum primum. The second septum will start growing, descending down, overlapping the septum primum from the left part or left portion of the septum primum. Again, one septum starts growing, descending down, overlapping the ostium secundum. Okay, so ostium secundum is started forming. The septum started growing at the same time. And now what has happened? The second septum has developed, and now this septum is called as the septum secundum. It is called as the septum secundum. Okay. Now what is the route for the blood flowing blood? The blood is coming from the opening of the sinus venosus. It is passing from from the inferior edge of the septum secundum, ascending upwards to the gap between the two. That is, one flap is like this, septum secundum. One flap is like this, is the septum primum, and there is a gap between the two flaps. Okay, so the blood is ascending here, and then it is going towards the left atrium. So these two septa are now acting as a flap wall mechanism. They are acting as a flap wall mechanism. If suppose these two septa are getting closed, the blood passage will be closed. The gap is present in between, the blood will flow here. Okay. But like that, the septum secundum has developed. Now just remember that. Anybody have a paper here? Paper. If a small rough paper is there, just give me. Not just don't cut it. Very small piece of paper, rough paper. Now just remember, suppose this is a paper, okay? This will consider it as a septum primum and septum secundum. We'll cut it into two parts. If suppose we can say this is a septum primum, it has descended down. This is a atrioventricular endocardial fissure. Right? First of all, the septum primum will start. It will come down and will fuse with each other. Septum secundum has developed. Ostium secundum has developed, and now this is the septum secundum which has developed. Now, this septum secundum, if you see, it has got a semilunar margin. It has got a semilunar margin. Okay. This septum secundum has got a semilunar margin, which is overlapping this septum primum. Overlapping this septum primum. Now, what is the blood? How the blood flow will pass? Will pass like this through this opening. Will ascend upwards. Will pass through the septum primum and ostium secundum. Okay, like this. Now, if suppose after birth, when the two septa will fuse with each other, What is the loop? How it will resemble? Septum primum will resemble as a depressed area. Okay, septum primum will be resembling as a depressed area which is present lying behind the septum secundum. And what is the margin here? This margin, it is overlapping this depressed area as a margin of the depressed area, If suppose this is the septum here, which is separating the two atria, okay, it has got one anterior margin, has got superior margin, has got posterior margin. Okay. Now here in our diagram, we will draw this particular added part like this. I will draw it here. This is the curved margin of the septum secundum. This is the curved margin of the septum secundum. This is the anterior margin of the septum secundum. This is the superior margin of the septum secundum. This is the posterior margin of the septum secundum. Where I will say that the anterior margin of the septum secundum, it is getting attached to the left end of the wall of the eustachian, wall of the inferior vena cava, that is the eustachian wall. And now what it is called as? It is called as the annulus fossa ovalis. Annulus means a round margin. What is it? It is a margin of this fossa. So this margin, it is a semilunar margin, which is called as the annulus fossa ovalis. While the depressed area we have seen, which is a remnant of septum primum, which are lying behind the semilunar margin. It is called as the fossa ovalis. So first thing we have seen in the septal wall is the depressed area, oval area, which is surrounded by the elevated margin, which is semicircular. This depressed area is called as the fossa ovalis. Fossa ovalis is a remnant of foramen oval. Okay. So fossa ovalis is a remnant of the foramen oval, which is represented by in adult heart by the septum primum. Okay. By the margin of this fossa ovalis, it is representing the remnant of septum secundum, semilunar margin of the septum secundum. So we can say that here in the septal wall of the right atrium, we can see the first feature is the fossa ovalis. We have described that fossa ovalis is the remnant part of the embryological foramen ovale, which is represented by the septum primum, which was forming the interarterial septum. The second part we can say it is called as the limbus fossa ovalis. It is called as the limbus fossa ovalis, or it is also called as the annulus fossa ovalis. It is a semillunar margin surrounding the foramen ovale in the embryological age, while it is forming the margin of the fossa ovalis in the adult heart, which has got the anterior wall, superior wall, and the posterior wall. It is surrounding that, and it is a remnant of the septum secundum. It is a remnant of the. To be more precise, we can say that it is a remnant of inferior free margin of the septum secundum. It is a remnant of inferior free margin of the septum secundum, and you can say that the lowermost end of the anterior wall of the septum secundum, it is getting attached to the left wall of the wall of inferior wall of the inferior vena cava. Okay, that is the two things we have seen here in the septal wall. The third part we can say in the septal wall, it is called as a triangle of Koch. The triangle of Koch. Okay, the third feature we can say in the septal wall, it is called as a triangle of Koch. Now, what is this triangle of Koch? Triangle of Koch is a triangular area. Triangle of Koch, it is a triangular area where one base of the triangle, it is formed by the septal leaflet. Base of the triangle, it is formed by the septal leaflet of the tricuspid orifice. Then there is one tendon which is extending from the septal leaflet to the inferior vena cava margin, okay. That tendon, it is forming one of the part of the fibrous skeleton of the heart, which is a part of the fibrous skeleton of the heart. What is the fibrous skeleton? It is nothing but a collagenous fibrous tissue, which is actually forming the basic skeleton of the heart, Like you can see the construction going on, and you can see some beams and pillars, which are actually the basic skeleton of that particular building, okay, which is formed by the horizontal beams and the vertical columns here, okay. And in between we can feel the brick construction, like that, right? Now the brick construction here, it is formed by the myocardium. But the basic fibrous structure, it is nothing but the form of the collagen fibers, and it is actually surrounding this particular walls here. Now, if suppose the fibrous skeleton, one annular fibrous ring is formed by the tough collagen fibers, which is representing the AV orifice, which is representing the atrioventricular orifice. That is the tricuspid, tricuspid orifice. Second annular ring we can see formed of the collagen fiber, representing the mitral orifice, Then another circular orifice we can see, which is the orifice of the pulmonary trunk, while another circular orifice we can see it's the orifice of the aortic, what we can say vestibular. Okay, so that are the four. First of all, the four annular rings are formed. And from there you can see the tendons are passing in between. Which are connecting these structures with each other. And now how the myocardium will be arranged? Myocardium will be getting attached to this particular part, getting flown here, going to this annulus like this, and such vertex arrangement of the myocardium is getting attached. If suppose from where it is going like this, okay, so such myocardial arrangement is passing from one chamber to another chamber, and such that the conical heart is formed. Like similar way we can say some myocardial structure tissue are going like this, and all the four orifices are giving attachment to this muscle fibers, So one tendon which is extending from the pulmonary trunk annulus, that is the infundibulum part of the pulmonary trunk, going to the right atrium. That tendon is going from here to here, that is it is getting attached to the septal leaflet here, going to the inferior vena cava, and that elevation is produced by that tendon. That tendon is called as the tendon of Tubercle. Okay. The tendon which elevation which is actually extending from the septal leaflet of the tricuspid wall to the coronary sinus, that is the tendon which is called the tendon of Tubercle. Now I will say that one margin of the triangle is formed by a tendon of Tubercle, one wall is formed by the posterior wall of the coronary sinus, and one wall formed by the septal plate of the tricuspid orifice. This triangle is produced in between these three structures. That triangle is called the triangle of Koch. That triangle is called the triangle of Koch. Now, why this triangle of Koch is essential? It is to know what is the function of this triangle. Why you should know that? Because one structure which is located in the triangle of Koch, and it is nothing but the AV node. It is nothing but the AV node. So part of the SA node we have seen it is situated here. During extension, where some part is going to this particular part because of the reflection of the one. But from the SA node, you can see the fibers are passing to the AV node. That is how the conduction is taking place. From the SA node, the impulse has started. It is conducted to the AV node. From the AV node, it is directed to the ventricle. From the AV node, it is directed to the ventricle through the bundle of peas. Okay. So AV node is situated in the triangle of Koch. So you should know that the whole structure or feature, it is the situation of the AV node. It is the situation of the AV node. It is the feature of the septal wall. It is the feature of the septal wall of the right atrium. After that, you can see the fifth feature. It is called as the torus aorticus. It is called as the torus aorticus. Now, what is this torus aorticus? Torus means what? Elevation. Torus is nothing but the elevation. Aorticus means what? It is produced because of the aorta. Which part of the aorta is producing the elevation? See, just remember that. Why aortic elevation? The aorta will start from here, from the left ventricle, right? It is the ventricular septum is like this. Interventricular septum is like this. Interatrial septum is like this. Interventricular septum is attached to the right edge of the atrioventricular endocardial portion, passing like this. This is the membranous part of the interventricular septum, and somewhere from here is the muscular part of the interventricular septum. It is the muscular portion, and it is the membranous portion. Okay, and some portion which is developed from the atrioventricular endocardial portion, that is a part of the ventricle, and one part is coming from the bulbar septum. That is the bulbous cortex part which is going to develop into the pulmonary trunk and the ascending aorta. So that we can see in this septal wall, suppose this is the ascending aorta part, this is the outgoing part of the left ventricle, outgoing part of the left ventricle, which is starting as the ascending aorta, Whenever there is ascending aorta, it is producing one elevation here. It is producing one elevation here. It is produced by the right posterior aortic sinus. It is produced because of the right posterior aortic sinus. Means what? Okay, the question comes. If you suppose see this particular is the opening of the aorta. Okay, you can see this is the opening of the aorta. It is a thick wall structure. This is the aortic vestibule. We can see that is the outgoing smooth part of the left ventricle. You can see near the ascending aorta. It is guarded by again tricuspid wall. Okay, it is the semilunar wall which are seen. And now here you can see a small elevations are produced because of the vessels which are taking origin from this particular area. This is called as anterior aortic sinus. This is called the anterior aortic sinus. This anterior aortic sinus is giving rise to the right coronary artery. It is giving rise to the right coronary. So right coronary is starting from the anterior aortic sinus. This anterior aortic sinus has got some bulge here. Can you see? Because the right coronary is coming out. Now this left posterior aortic sinus is giving rise to the left coronary artery. And this right posterior sinus, which is present here, this right posterior sinus, it is producing a bulge in the right atrium. Because it is situated somewhere here. It is producing a bulge in the septal wall. Actually, the right posterior aortic sinus is not giving origin to any vessel. Okay, so it is called as a non-coronary sinus. Because the anterior aortic sinus is giving rise to the right coronary, left posterior aortic sinus is giving rise to the left coronary, while the right posterior aortic sinus is called as a non-coronary sinus because no coronary artery is taking origin from the ascending aorta from this sinus. So sometimes in the MCQ it is asked like that. Following is the name or the right posterior coronary sinus. If suppose it is asked as a answer I want to ask you. Okay. So following structure it is called as a non-coronary sinus. Right posterior, right anterior, or the vice versa, or the left posterior. Just remember that. Why I am saying that? Because for the pulmonary trauma, it is exactly reverse. It is one posterior and two anterior are produced. One posterior and two anterior are produced. Okay. So this is posterior, right anterior, left anterior. Exactly reverse the outcome. Okay, so I can take one option from these here also for the answers. The right answer for right non-coronary sinus is the right posterior. Okay, right posterior. Or sometimes it is asked like the right coronary artery arises from. That is the anterior aortic, right posterior aortic, or non-coronary. At that time, the non-coronary is right posterior, okay, or left coronary, like that. Somewhere in the MCQs it is asked like the non-coronary sinus. At that time, you should remember that the right posterior aortic sinus is the non-coronary sinus. Is the non-coronary sinus. Are you getting this? So that is the non-coronary sinus. It is producing one elevation in the right atrial septal wall. Okay. Because the septal wall is oblique, septal wall is oblique, so that it is producing one elevation that is called the torus aorticus. That is called the torus aorticus part. So these are the features which are seen in the septal wall. These are the features which are seen in the septal wall of the right atrium. Just remember that right atrium as a whole is a full question. Development of the interatrial septum is a full question, short note. Development of the interventricular septum is a short note. Remnant of the foramen opera as it is in the afterbirth also. Okay, that is the phallus tetralogy. That is a short note. Interatrial septal defects are a short note. Interventricular septal defect is a short note. Okay, everything is important here as a short note of the full question. And in the embryological models also, I think you have seen the general anatomy models. In that, hardly 3 models are kept for the examination from the heart. One is the development of the interatrial septum model is kept, development of the interventricular septum model is kept, and development of the aorta and the pulmonary trunk. Okay, that model is kept here for the examination purpose in the embryology. These 3 are definitely there presented. Okay, so be careful for this. So I am taking the 5 or 6 lectures on the heart. Okay, in detail. Again, I am revising the embryology also associated part. No, if suppose there is no need to again revise this embryology part. I can only say that these are the features of the septal wall, these are the features of the posterior wall. But again and again, you have to revise this particular part. Okay, so it is a very important question related with the thorax part. So that is the right atrium we have completed here. That are the features of the 3 walls we now seen. That is the anterior wall, posterior wall, and the septal wall we now seen. Okay. Now, after the completion of the right atrium, we have to go now towards the next chamber of the heart, that is the right ventricle part. That is the right ventricle part. So, we will see after the right atrium, we will complete the right ventricle, then we will see the left atrium, and then we will see the left ventricle. Okay. So now we can say that in the right ventricle part, what are the features of the any ventricular chamber? In any ventricular chamber, whenever you are studying the right ventricle or the left ventricle, there is one inflowing tract and there is one outflowing tract. Okay, there are 2 tracts which are present in the ventricular chamber. One is the inflowing part and one is the outflowing part. Just remember that always the outflowing part of the right ventricle and the left ventricle are smooth. Because we don't want any resistance there, because the blood is flowing against gravity. Okay, so there must be no resistance there. So everywhere you can see the right ventricle or the left ventricle, the outflowing part is a smooth. Okay? While incoming part or inflowing part is always rough. Inflowing part is always rough. Okay, so we are distributing or dividing the right ventricular internal structure into incoming or inflowing rough part and the outflowing smooth part. Now today I am not repeating again the relations of the right ventricle, where it is situated, what is the anterior structure of, just remember that, okay, because everything you know in the gross anatomy part. Or shall I repeat? Okay, so directly we will move to the internal structure of the right ventricle. Okay. In the external feature, now we are knowing that the right ventricle is situated to the left and anterior aspect of the right atrium. Left and anterior aspect of the right atrium. It is overlapped by the pericardium and overlapped by the left lung with the left pleura, separating the anterior surface from the external surface from the anterior surface. Okay, it is forming part of 1/3 portion of the and inferior surface of the heart, that is the diaphragmatic surface of the heart, and the 2/3 portion of the sternocostal surface of the heart. Okay, separated from the atrial chamber by the coronary sulcus, coronary sulcus. Okay, that's the gross features we have seen. Now going to the inflowing part and the outflowing smooth part. Suppose is the right atrium here. This is the, we can say this is the pulmonary trunk which is passing out above. This right atrium is guarded by one structure here, that is the tricuspid wall. That is the tricuspid wall here, and this is the total we can draw. This is the right ventricle. This is the total right ventricle we can draw here. Okay. Now just remember that this is the part where the blood is passing outside to the pulmonary trunk. This is the orifice where the blood is passing inside the right ventricle. Now, if you see the thickness of the right ventricle, you can see this is the myocardium, which is actually muscular portion of the right ventricle. It is thicker than the right atrium. It is thicker than the right atrium part. You can see this is formed by the myocardial tissue, that is the cardiac muscle, the radius here. And this is the part of the interventricular septum. This is the part of the interventricular septum. Now, what are the features which we can see in the ventricular part? Now, we can see the first of all the wall which is guarding the atrium and the ventricle orifice. You can say that there are three. First, we have tricuspid wall, and so that we have said this is the anterior leaflet, this is the septal leaflet, and this is the posterior leaflet. This is the septal leaflet, and the septal leaflet, anterior leaflet, and the posterior leaflet. The septal leaflet is toward the interventricular septum. Okay. Now, just remember that the outflowing smooth part, it is separated from the incoming rough part by one muscular elevation. And this muscular elevation, it is called the supraventricular crest. It is called the supraventricular crest. Okay. So whenever you take the heart into your hand, open the right ventricle, immediately you can look or peep inside the right ventricle. You can immediately say that this is the smooth part, this is the rough part, and you can see one elevation which is actually what we can say, the margin or line of separation between the outflowing smooth part and the incoming rough part. This is called the supraventricular crest. This is called as the supra means above, present just above the ventricle, so it is called as the supraventricular crest. It is called the supraventricular crest, which is separating the outflowing smooth part from the incoming rough part. Okay. That is a muscular elevation which is separating the two zones from each other. Now just remember that we will concentrate on the incoming or inflowing rough part, Now what you can see in the inflowing rough part, I can see there are multiple elevations and depression. There are multiple elevations and depression. These elevations and depressions are no doubt they are muscular. And they are divided into three types of band. What are the three types? They are the ridges, and they are the pillars. Okay, and the third will be the pillars. Okay, there are the three types of elevations which are seen. One is the ridges, one is the bridges, and one is the pillars. Okay, the ridges are nothing but the muscular elevations. They are linear elevations produced here. They are the linear elevations. So, if you take this is a wall here, wall of the myocardium, you can see these are the linear elevations which are present in single line. Okay, you cannot say take a separated part. That is one end is attached, and intermediate area is away from the myocardium. It's not like that. It is throughout the elevation produced as a ridges. Same ridges we can see in the stomach also, that are part of the canal, gastric canals. Okay, elevations of the mucosa. Here it is not elevation of the mucosa or the structure or the epithelium, but it is the muscular elevations which are produced here. And these are called as the ridges part. They are called as the ridges part. Okay, so they are actually fixed elevations. They are the not fixed elevations which are called as the ridges. The second type we can say as the bridges. Bridges means not one end is fixed. Second end is fixed, and you can see the intermediate area gap like a bridge, okay? They are called as the bridges. And now what is the function of these bridges and ridges? They are actually reducing the turbulence of the inflowing blood. They are reducing the turbulence of the inflowing blood or the speed of the inflowing blood. Okay, they are like the speed breakers. They are like the speed breakers. Okay, one of the bridge here, it is very important, which is actually extending from the septal wall. One of the bridge, it is extending from the septal wall, and this bridge, one end is attached to the septum of the interventricular septum on the right side, and the other end of this particular bridge, it is getting attached to the anterior papillary muscle. Other end is attached to the anterior papillary muscle, and this is called as the septomarginal trabecula. This is called as the septomarginal trabecula. This particular bridge, it is called as the septomarginal trabecula. Why is it called as septomarginal? Because one end is attached to the interventricular septum and other end is attached to the anterior pillar. That is the anterior, what we can say, papillary muscle, the margin of the papillary muscle, the anterior papillary muscle. So it is called as the septomarginal trabecula, or it is also called as the moderator band. It is also called as the moderator band. What is the meaning of moderator? What is the meaning of moderator? It is actually keeping in check. It is keeping a check like that. Okay. Now here, who is keeping the check and on whom? Here, this moderator band, it is keeping the check on the intraventricular pressure of the blood. Okay, intraventricular pressure of the blood, which is leading to the dilatation of the ventricle, which is leading to the dilatation of the ventricle. If suppose the over dilatation is taking place, the moderator band is getting stretched. Moderator band is getting stretched and it is not allowing the further stretching. It is not allowing the further dilatation. So that this particular band, which is not allowing or it is checking the intraventricular pressure and dilatation of the right ventricle, this particular septomarginal band trabecula, it is called as the moderator band also. It is called as the moderator band also. And this moderator band of septomarginal trabecula is the example of the breach. Is the example of the breach. Okay. So we have seen that the supraventricular place. We have seen the moderator band of the septomarginal trabecula and the bridge. Such multiple number of bridges and ridges are situated in the lumen of the ventricle, the lumen or cavity of the ventricle. Okay. The third type is called as the pillars, and the example of the pillars is nothing but the papillary muscles. They are nothing but the papillary muscles. Now, I think in the high school or in the junior college, you have studied that. If suppose there are three curves, there are three pillars are present. If two curves come, there are two pillars are present, or two papillary muscles are present. It's right. There are three papillary muscles are present in the right ventricle. There are two papillary muscles are situated in the left ventricle. Now, what are the three papillary muscles? One is called as anterior papillary muscle, which is the largest and thickest muscle. The second is the septal papillary muscle, which is very small, and third is called as the posterior papillary muscle. Okay, so the septal is coming from the septal wall here. You can see it is very small papillary muscle. The posterior is coming from the posterior wall of the right ventricle, while the anterior is the thickest and present on the anterior or the sternocostal wall of the right ventricle. Such three papillary muscles are situated in the right ventricle. What is the function of these papillary muscles? What is the function? The apical portion of the papillary muscles are giving attachment to the fibrous tissue. They are giving attachment to the fibrous tissue. In turn, this fibrous tissue, they are getting attached to the leaflets. They are getting attached to the leaflets here. And what is the name of this? They are called as the Cauda tendinae. The Cauda tendinae, they are getting attached to the tip or apices of the papillary muscle. Now, how are the attachment, or how is the attachment of the Cauda tendinae here? We can say that if suppose this is the annulus of the tricuspid wall. This is the annulus of the tricuspid wall. Why I talk straight? I have taken out it and I have cut it and I have actually linearly arranged. Okay. So what is the arrangement here of the cusp? If suppose this is the one cusp, that is the anterior cusp of the tricuspid leaflet. Okay. This is the second cusp, that is the posterior cusp of the tricuspid leaflet, and it is a smaller septal pus called the tricuspid leaflet. Are you getting this? How I have arranged it? Because to understand, only it is a rounded structure. I have cut at one thing. I have straightened it. Okay, I have straightened it. So these are the three septa, or these are the three cusps which are attached to the basal annular fibrous ring. Which is this annular fibrous ring? Whichever we have seen in the fibrous skeleton of the arm. Okay, we have seen at first there are four fibrous rings are attached, or they are formed by the collagen fiber. Okay, that we have seen the tendon of pterodactyl and everything muscles are getting attached to that particular annulus. So this is the fibrous annulus or the ring of that particular tricuspid orifice. Okay, and to the fibrous ring, the septum or the walls or the cusps are getting attached. The cusps are also formed of the collagen fibers. Their cusps are also formed. Basic skeleton of the cusp is the collagen fiber, surrounded by the endocardium. Surrounded by the endocardium, covered by the endocardium. Each cusp has got three zones. Each cusp has got three zones. Okay, one zone which is called as the rough zone. Okay, this is the rough zone. That is. This is the rough zone, and here is the rough zone of the cusp. Then behind that is the clear zone. It is the clear zone. Each cusp has got this rough zone. It is the clear zone, very smooth or clear zone, and it is called as the basal zone, where by means of which it is getting attached to the annular fibrous ring. The basal area or the basal zone, by means of which each cusp is getting attached to the annular fibrous ring. Annular fibrous ring. Why this rough zone is called as a rough? Because this rough zone is giving or providing attachment to the fibrous tissue. It is providing attachment to the fibrous tissue. And what is this fibrous tissue? This fibrous tissue is nothing but the caudate tendon. It is nothing but the caudate tendon. Now, where this caudate tendon are passing? These caudate tendon, they are passing to the apex of this papillary muscle. This caudate tendon are passing to the apex of the papillary muscle. Whenever the papillary muscle is getting contracted, what will happen? Muscle is getting contracted, cusp is getting opened, and the blood will flow inside the ventricle. When the muscle getting relaxed, the caudate tendon are getting relaxed, cusp will be closed. Like that. Okay. So this area is rough because of the attachment of the caudate tendon. Caudate tendon are coming together and getting attached to the apices of the papillary muscle. So for the tricuspid orifice, there are three cusps are present. For the mitral orifice, there are two cusps are present. For the mitral orifice, two cusps are present. So this is the basic arrangement of the pillars and the caudate tendon. Okay, and what we can say that these three muscles are giving rise to the caudate tendon for the different cusps. Anterior caudate are getting attached to the anterior leaflet. Posterior caudate are getting attached to the posterior leaflet, and the septal caudate are getting attached to the septal leaflet of the tricuspid orifice. Okay, tricuspid orifice. So we can say that now what are the features we have seen in the right ventricle? Incoming rough part guarded by the atrioventricular orifice on the right side, which is called the tricuspid orifice, having three cusps, anterior, posterior, septal. Then we have seen the separation between the outgoing smooth part and the incoming rough part, and by the supraventricular crest. Inflowing rough part, we have seen there are multiple rough zones because of the ridges, bridges, and the pillars. We have seen these ridges are nothing but the linear elevations of the muscles, myocardium. Bridges, two ends are getting attached. Intermediate area is actually vacant, or you can see a loop-like structure there, and the pillars in the form of the papillary muscles, which are providing attachment to the caudate tendon. One of the bridge we have seen, which is very what we can say is the prominent, and it is nothing but the moderator band. The second important thing about the moderator band is that if suppose you can see this bundle of pieces coming like this, passing in the interventricular septum from the AV node, the major fibers of the bundle of leaves are going to the moderator band also. Okay, they are actually carrying the reflexes now. Over distension is taking place. So one of this bundle of fibers is going to the moderator band. Okay, taking the sensations from the right ventricle. Okay, so we have seen that there are three papillary muscles, one is the anterior, one is the septal, and one is the posterior. Okay, so So that is about the what we can say inflowing rough part. Now going to the outflowing smooth part, it is called as the pulmonary infundibulum. The outflowing smooth part of the right ventricle, it is called as the infundibulum because it is resembling the inverted funnel-like structure. Inverted funnel-like structure, so it is called as the infundibulum of the pulmonary trunk. And this outflowing smooth part, it is guarded by the semilunar wall. It is guarded by the semilunar wall, which is a bicuspid wall. Which is a bicuspid wall, and it has got a node here, and we can see the what you can say lunule. That wall has it is not a smooth wall here. It has got a like structure. This is called the node. These are called as the lunule. They are called as the lunule. Sorry, it is a tricuspid wall, and this is a lunule and the node there. Okay. So these are the semilunar walls which are guarding the pulmonary infundibulum. That is guarding the pulmonary infundibulum. Okay. Are you getting this? So that we complete the right ventricle. Now we'll shift to the left atrial part. The left atrium is separated from the right atrium by the intra-atrial septum. Right atrium by the intra-atrial septum. The left atrium is situated on the posterior aspect of the heart, which is forming which part of the heart? It is forming the base of the heart or the posterior surface of the heart. Okay. It is separated from the right atrium by the intra-atrial sulcus, while it is separated from the ventricles by the coronary sulcus, by the posterior part of the coronary sulcus. Majority portion of the left atrium, it is formed by absorption of the pulmonary veins. It is formed by the absorption of the pulmonary veins. I think you understood or remember that particular diagram. One pulmonary vein divided and redivided into four pulmonary veins, and the intermediate area, it has absorbed into the left atrium part. It has absorbed into the left atrium part. The left atrium, it is a ovoid structure. It is a ovoid structure shape. If you see on the internal features of the left atrium, it has also two parts, that is the rough part and the smooth part. Rough part is mainly formed by the left half of the common atrial chamber, like the right atrium we are seeing. Okay, so always remember that the rough part are the derivatives of the common atrial chamber. The rough parts are the derivatives of the common atrial chamber. Either you can take the right atrium or you can take the left atrium. Always remember the rough part is a derivative of the common atrial chamber. Right half of the common atrial chamber will give rise to the right atrium rough part. Left half of the common atrial chamber will form the rough part of the left atrium. Rough part of the left atrium is called the left auricle. Rough portion of the left atrium is called the left auricle, which we can see forming the left border of the heart, which is forming the left border of the heart. Okay, that is called the left auricle. Again, you can see such muscular arrangement inside. You can see the linear elevations inside the left auricle, like we have seen the muscular pectinity in the right auricle. Same rough part is seen here. The left atrium also. Posterior, that is the smooth part of the left atrium, it is formed by the absorption of the pulmonary veins. It is formed by the absorption of the pulmonary veins. And on the posterior smooth part of the left atrium, you can see four openings of the pulmonary vein. On the posterior smooth part or smooth wall of the left atrium, you can see four openings of the pulmonary veins. You can say pair of the left pulmonary veins and pair of the right pulmonary veins. Superior and inferior right pulmonary, superior and inferior left pulmonary veins. Okay, that is forming the posterior smooth part of the left atrium. Now the third wall of the left atrium remaining is the septal wall. Is the septal wall. Okay, the septal wall is nothing but the left wall of the interatrial septum. Left wall of the interatrial septum. Now tell me what you can see on the left wall. See, just remember you have seen the right wall. On the right wall, what you have seen? One depression you have seen. That is the fossa. How you can see from here? Opposite side. If this is pressing like this, you can see elevated area. You can see the elevated area on this side, and you can see the limbus fossa ovalis as the elevated area on the right atrium. How it will look from the left atrium? It is a depressed area, and that is called as a fossa lunata. That is called as a fossa lunata, which is actually nothing but the remnant of the septum primum and septum secundum, which we can see the fossa ovalis in the right atrium and the limbus fossa ovalis in the right atrium. Immediately on the left side, you can see one depressed margin and one elevated area. One depressed margin and one elevated area, which is called as the fossa lunata. That depressed semilunar margin of the septum secundum It is called as the fossa lunata from the left atrium side. From the left atrium side. What are the features? And the second feature we can see in the left atrium everywhere, like we have seen in the right atrium, is that there are the foramina minerum. Okay, they are nothing but the veiny cord is minimi. Nothing but the veiny cord is minimi. We have seen that. They are seen in the right ventricle also. They are seen in the left atrium also. They are seen in the right atrium also. Left ventricle also. They are nothing but the foramina minerum. Okay. So that is about the left atrium. Now going to the next chamber, that is the left ventricular chamber. Left ventricular chamber, if you compare the thickness, it is 3 times more thick than the right ventricle. It is 3 times more thick. I think you have seen in the heart also, right? In the dissection hall. Okay, that is, if suppose it is small, thickness is very small here, it is very thick there. Okay, that is 3 times more thicker. If you see the mitral orifice and the tricuspid orifice, the size of the mitral orifice is comparatively smaller than the tricuspid. If you measure the diameter of the tricuspid orifice, it is 11.4 centimeters in male and 10.8 centimeter in female. While here the mitral orifice, if you measure the diameter, it is hardly 8 centimeters in male and 7 centimeters in females. Okay, so comparatively the opening guarding, what you can say, the opening of the atrioventricular opening also larger in right side, smaller in left side. It is guarded by 2 walls in the left side. It is guarded by 3 walls on the right side. These 2 wall structure is called as the mitral walls. They are called as the mitral wall. Because of that, the orifice is called as the mitral orifice. The orifice is called as the mitral orifice, having 2 leaflets only. One is the anterior leaflet and one is the posterior leaflet. What is the posterior leaflet? Okay. Going to the right ventricular internal structure, same way you can see the inflowing rough part is there and there is the outflowing smooth part is there. Outflowing smooth part of the left ventricle, it is called as the aortic vestibule. It is called as the aortic vestibule. Okay. While the inflowing smooth part is you can see the same way the 2 papillary muscles are seen in the pillars and you can see the ridges and ridges. They are seen the ridges and ridges. Only thing is that there are 2 papillary muscles. One is the anterior papillary muscle, one is the posterior papillary muscle and extending what we can say the party tendon. Whole of this rough area they are called the trabeculae carni. Okay. That is the, you can say the ridges, you can take the bridges, you can say the pillars, total elevated structure, myocardial elevation, they are called the trabeculae carni. Okay, they are called the trabeculae carni. Trabeculae carni includes 3 elevations. Okay, trabeculae carni is composed of ridges, bridges and the pillars. So here you can see the 2 pillars, that are the anterior and posterior papillary muscle, and you can see the cardi tendon. Same arrangement of the cardi will be there. There is a rough zone, there is a clear zone, there is a annular of the basal zone, by means of which it is attached to the annular margin of the mitral orifice. Okay. So that's what we have completing the 4 chambers of the heart here. 4 chambers of the heart here. Now we are moving towards the blood supply and the nerve supply of the heart. Okay, blood supply and the nerve supply of the heart. In the blood supply of the heart, first of all, we'll take blood supply of the heart is again a full question. Nerve supply of the heart is a short nerve. That is the cardiac plexus. Okay. So one more lecture will be required to complete the blood supply and nerve supply of the heart. In the heart, we can say that blood supply, mainly the arterial supply. And the renal drainage we are going to cover. In the arterial supply, we are saying that the arteries supplying the heart are nothing but the coronary arteries, and the coronary arteries are called as the largest vasa vasorum in the body. Coronary arteries are called as the largest vasa vasorum in the body. Why they are called as the largest vasa vasorum? Because heart is considered as a large artery. Heart is considered as a large artery. Artery supplying to the artery is nothing but the vasa vasorum. Arteries supplying the arteries are nothing but the vasa vasorum. Coronary arteries are supplying the heart, so they are the largest vasa vasorum. Second feature related to the coronary artery, they are considered as the end artery. They are considered as the end artery. See, anatomically they are said as the end arteries because they are ending at one end. But functionally, you cannot say that the coronary arteries are the end arteries because there is a tremendous anastomotic channel between all these arteries. There's a network of the arteries. Okay, so those we can say structurally eight arteries. Functionally, they are not the eight arteries. Okay, so these are the two important features. They are the coronary arteries of the vasa marginum, and second will be they are considered as the eight arteries, but they are not eight arteries because of the tremendous amount of the anastomosis. Okay. Now we can say that first of all we concentrate on the arterial supply of the heart. We have said that the coronary arteries are the branches of. See, this is a very simple question. Very simple question I am asking here. Coronary arteries are branches of, but whenever the question comes in the examination, the answer is the branch of arch of aorta, branch of descending thoracic aorta. This is the branch of ascending aorta. Coronary arteries are the branches of the ascending aorta. Be clear that never say that it is a branch of arch of aorta. Never say that it is a branch of descending aorta. It is the branches of ascending aorta only. Okay. So there are two coronary arteries. We have said that one is the right coronary and one is the left coronary artery. There are two coronary arteries. One is from the right coronary, called as the right coronary artery, and one is called as the left coronary artery. The right and left coronary arteries, they are taking origin from the ascending aorta of the aortic sinuses. From the aortic sinuses, we have seen that each part is guarded by the three sinuses. For pulmonary trunk also there are three sinuses. For aorta also there are three sinuses. For aorta, one is the anterior aortic sinus and there are two posterior aortic sinuses. Anterior aortic sinus is giving rise to the right coronary artery, while the left posterior coronary sinus is giving rise to the left coronary artery, while the right posterior coronary sinus, it is called as a non-coronary sinus. It is called as the non-coronary sinus. Now again we will draw the diagram. This is the superior vena cava. This is the right atrium extending from the superior vena cava to the inferior vena cava. This is the right auricle and this is the part of the right atrium here. We can say that somewhere here is the right ventricle extending superior via the pulmonary trunk, while this is the left ventricle which is passing here with the right left auricle part, and you can say that this is the arch of the aorta which is from like this, having three branches. One is the brachiocephalic left counteracted and the left subclavian and the left subclavian. Now, if you see that origin of the right coronary artery, first of all, we will consider the right coronary artery. Right coronary artery, from where the origin is? Origin from the anterior aortic sinus from the ascending aorta. I am again splitting this question because right coronary is a short note, left coronary is a short note. If I will not ask the full question of the blood supply of the heart, I will somewhere ask the right coronary at the short note of the coronary, short note of the coronary sinus of the short note. We have separate short notes. So origin is from the anterior aortic sinus from the ascending aorta. What is the course? How to write the short note? Course is the introduction part. The major artery supplying the heart. In the origin we have seen. Then we have to mention about the course of the artery. We have to mention about the course of the artery. Then after that we are going to say about the where it ends, and after that what are the branches? What are the branches? And what is the area of supply? What is the area of supply? Why you should know the area of supply? Sometimes we say that it is the right coronary dominance, it is the left coronary dominance. You should know what is the area supplied by the right coronary and what is the area supplied by the left coronary. Depending on that, the dominance of the coronary artery is actually manifested in the clinical condition. Anybody have seen the angiogram? You can see all the vessels, right coronary dominance, left coronary dominance. You can see the dye which is injected in the coronary artery, and you can see the graph. At that time, they are deciding which coronary dominance. Okay, so like that, this will be the theme of the short note. The right coronary artery origin we have seen. In the course part, we can say the course it is taking origin from the right coronary. Anterior coronary sinus is passing behind the pulmonary trunk. It is passing behind the pulmonary trunk. When it comes out of the ascending aorta, it passes through the coronary sulcus. Coronary sulcus, that is the atrioventricular groove. Passes behind the pulmonary trunk on the right side of the coronary sulcus, on the right side of the coronary sulcus, and then it passes in the Which is this groove? It is the anterior coronary sulcus. It is the anterior part of the coronary sulcus. It passes between the right atrium and the right ventricle. It passes between the right atrium and the right ventricle on the sternocostal surface of the heart. On the sternocostal surface of the heart. So after origin, it passes behind the pulmonary trunk and then it comes towards the pulmonary infundibulum, comes out between the right auricle and the pulmonary trunk. It descends on the sternocostal surface of the heart in the coronary sulcus, in the atrioventricular sulcus or in the coronary sulcus. Up to what? Up to the inferior margin of the heart. Up to the inferior margin of the heart. In the inferior, after the inferior margin of the heart, it passes on the posterior surface. It passes on the posterior surface. Passes through the posterior interventricular groove. It passes through the posterior interventricular groove and gives the branches anastomosis with the circumflex branch of the left coronary. Sometimes, okay, anastomosis with the circumflex branch of the left coronary. That way, it will aid by anastomosing the circumflex branch of the left coronary artery. Okay, that is the course of the right coronary. That is the course of the right coronary. After the course we have mentioned about the end also, it is ending by anastomosing with the circumflex branch of the left coronary artery. Now, what are the branches? What are the branches of the right coronary artery? Right coronary artery, whenever it comes passing behind the pulmonary trunk, it gives one branch to the pulmonary trunk, that is called the conal branch. It is giving one branch that is called as the conal branch. It is giving the conus of the pulmonary conus. See, what is pulmonary conus? It is the narrow ascending portion of the pulmonary trunk. It is the narrow ascending portion of the pulmonary trunk, which is called the conus, pulmonary conus. So it is giving one conal branch, which is the first branch given by the right coronary. It is the first branch given by the right coronary. The second branch, which is given by the right coronary, is called as the nodal branch. It is called as the nodal branch. Okay, it is called as the nodal branch here. This nodal branch is given to the SA node. Given to the SA node. If it is not supplied by the left coronary, the right coronary is giving one branch to the SA node. It is not supplied by the left coronary. The right coronary is giving one SA nodal branches, or sometimes both the arteries are giving the SA nodal branch. Both the arteries are giving the SA nodal branch. So we are mentioning it as a nodal branch of the right coronary. The third branches are given are called as the atrial branches. They are the atrial branches. Okay. What are the atrial branches? Whenever it is passing through the coronary sulcus, it is giving 2 to 3 atrial branches to the right atrium. 2 to 3 atrial branches to the right atrium. Okay. Now after that, it is giving some ventricular branches. Correct. These are the ventricular branches which are supplying the anterior surface of the right ventricle. They are supplying the anterior surface. How much area of the anterior surface? 7 meters. The stream which is lying by the side of the anterior interventricular groove, except this area, remaining whole area is supplied by the right ventricular branches. Right? Ventricular branches. Okay. This is the remaining part next time. Okay. On Thursday. Thursday, I think there are lectures. Both of them will be edited. One is for the blood supply of the brain with the cardiac plexus, and second will be the heart of the okay. And I think you should see the timetable from timetable because your examination it is postponed, so that it is converted into the schedule, lecture schedule. Okay.